as the main witness for the prosecution, namely Mrs. MCL, refused to answer to the questions asked by the prosecution. She was consequently fined 2,000 rupees for contempt of court. Mr. Speaker, sir, in regard to Part A of the question, I am informed by the Commissioner of Police that since 2005 to 2008, Mrs. MCL undertook 17 overseas trips. Details pertaining thereto are as follows. In the year 2006, she effected 1 trip to France and 3 trips to Reunion Island. In the year 2007, she effected 2 trips to France and 5 trips to Reunion Island. And in the year 2008, she effected 4 trips to France and 2 trips to Reunion Island. Mr. Speaker, sir, I am informed that Mrs. MCL was in regular contact with Honorable Richard Duval when he was Parliamentary Private Secretary during the year 2008. They had traveled on 20th of July 2008 on the same flight. Mr. Richard Duval proceeded to Zurich via Paris, while Mrs. MCL traveled directly to Paris. Mrs. MCL returned on 23rd of July 2008, whereas Mr. Richard Duval returned 3 days later, that is on 26th of July 2008. Mr. Richard Duval often received Mrs. MCL and Mr. ACM at his office. Moreover, the latter was found by his side whenever he received his constituents at Mayberg Citizen Advice Bureau. I am also informed that Mr. Richard Duval had even intervened for VIP facilities in favor of Mrs. MCL. Moreover, on 2 occasions, she was guest of Mr. Richard Duval at the National Assembly. I am further informed that Mr. Richard Duval asked 500,000 rupees from her to pay his shares to a horse racing stable. And as she was out of funds, Mr. Richard Duval made necessary arrangements with the Development Bank of Mauritius for her to contract a loan of 700,000 rupees, which was approved and disbursed within 1 week. Out of the 700,000 rupees, an amount of 500,000 rupees was remitted over the counter to Mr. ACM on behalf of, on account, I would say, of Mr. Richard Duval. Thank you.
Thank you, Speaker, sir. Can Honorable Prime Minister inform the House whether there was any relationship between Mr. ACM and the former PPS, Richard Duval, and whether there was any arrest made for a drug case? Thank you.
Mr. Speaker, sir, I am informed that Mrs. MCL stated to the police that Mr. ACM was, and I quote, l'IMP, l'homme à tout faire de Richard Duval, unquote. I am also informed that former PPS Richard Duval often met Mr. ACM in the company of Mrs. CL at his office. Moreover, Mr. ACM was regularly found by the side of Honorable Richard Duval whenever the latter received his constituents, as I said earlier, at the Mayberg Citizen Advice Bureau. I am further informed that Mr. ACM was sentenced in 2014 on 3 counts: drug dealing and cultivation of cannabis, drug dealing and possession of cannabis seeds for the purpose of cultivation, and smoking cannabis. I am further informed that Mr. ACM was arrested in 2017 and charged for drug dealing with aggravating circumstances. Police secured 658 plants of cannabis in a chassé at Marovakwa, the street value of which was estimated at nearly 2 million rupees. After completion of the inquiry, the case file was forwarded on 1st of December 2022 to the office of the DPP for advice. And it's good to know that counsel for Mr. ACM in this case was Mr. Shakil Mohammed.
Thank you, Speaker. Sir, I have one last question. Can Honorable Prime Minister inform the House whether during the police investigation, phone conversation of Mrs. CL was probed and whether incriminating element was found? Thank you.
Well, Mr. Speaker, sir, I am informed that after the arrest of Mrs. CL on 23rd July 2008, it's good to remember the date, the latter was in possession of a mobile phone. Same was secured, and upon downloading of the phone's SIM card, it was found that the phone book contained mobile phone numbers owned by Mr. DMB, the constituency clerk of the then PPS Richard Duval, and that of Honorable Richard Duval himself. It was established that Mr. DMB called Mrs. CL on 20th of July 2008 at 7:37 in the morning, 7:50 in the morning, 8:03 hours in the morning. Mrs. CL had called the constituency clerk of Honorable Richard Duval on 23rd July 2008 upon her arrival at 5:27 hours, 5:40 hours, 5:48 hours, 11:32 hours, and 12:03 hours. The phone book also revealed that Mrs. CL called Honorable Richard Duval on 19th of July 2008 at 19:06 hours and on 20th of July 2008 at 8:26 hours.
Time over. The table has been advised that PQB 323 has been withdrawn. Honorable Lomia.
B324. Mr. Speaker, sir, leptospirosis is a zoonotic disease, that is, one which is spread between people and animals, with its main reservoirs primarily being rats, but also certain livestock such as cattle and goats, and certain domestic animals, including dogs. These animals excrete a pathogenic bacterium, Leptospira. In their urine, human contamination occurs through mucous membranes or through damaged skin by direct contact with the urine of infected animals or through contact with a humid environment contaminated primarily by rat urine. Leptospirosis is a globally distributed disease, with its incidence being 50 to 100 times higher in tropical regions. The seasonality of the disease is very pronounced, with a peak during the rainy season. Indeed, the heat and humidity increase the lifespan of the bacteria in the ambient environment. Mr. Speaker, sir, with climate change, cyclones and heavy rains have been much more frequent this year. The accumulation of rain has flooded the underground tunnels, causing rats to emerge to the surface. Furthermore, many fruits have fallen, meaning that rats have an ample food available, leading to increased reproduction. Females can have offspring as early as 3 months old. Litters typically range from 8 to 14 offspring, and a female can have up to 8 litters in a year. More rats, therefore, mean more opportunities for mating, and thus we have a continually rapid multiplication of the rat population. This situation has affected both Mauritius and Réunion Islands. In the sister island, the epidemic started earlier and is much more significant this year than the previous years. In the first 4 months of the year 2024, the number of leptospirosis cases exceeds the annual rate ever recorded in previous years. 169 cases with 3 deaths in 2022, 171 in 2023, and compared to 204 cases from January to late April 2024. In Réunion Island, several schools have have had to close their doors due to rat infestations. In Mauritius, we have recorded a total of 40 cases. In 2023, we had a total of 37 cases of leptospirosis, and in 2024, up to date, we have recorded a total of 28 positive cases of leptospirosis. Mr. Speaker, sir, leptospirosis can present a wide range of symptoms, including fever, rigors, myalgias, headache, nausea, vomiting, diarrhea, non-productive cough, arthralgia, bone pain, sore throat, abdominal pain, and rash, some of which may be mistaken for other diseases. Diagnosis is made based on a clinical assessment and confirmed by a positive PCR of blood or by positive serologic testing. All infected patients are admitted promptly to a public or private health institutions and are administered treatment according to the symptoms and severity of their respective cases. Without appropriate or timely treatment, leptospirosis can lead to kidney damage, meningitis, liver failure, respiratory distress, and death. Mr. Speaker, sir, with regard to the question, I'm informed that there is a rodent control unit which is under the purview of the Public Health and Food Safety Department of my ministry, and which is responsible for rodent control program for all public health institutions such as the hospitals, medical clinics, area health centers, community health centers, and other departments of my ministry. The rodent control activities include baiting with rodenticide outside the building, placing of rat glue inside premises, and collection and disposal of dead rats by incineration or burial. The same activities are carried out at point of entries like port and airport. Moreover, there are other specific rodent control activities which are carried out as such: deratting of vessels at the port, and placing rat traps in port areas and sending samples to the Central Health Laboratory or the Vector Biology and Control Division for testing. In addition, Public Health and Food Safety Inspectorate carries out regular inspection of food operators, and both public or private institutions under the Public Health Act to check for compliance with Food Act and food regulation, which includes but is not limited to rat infestation. In case of rat infestation, a prohibition order of notice prior to closing order is issued under the Food Act. Mr. Speaker, sir, I'm also informed that my ministry is not responsible for rodent control activities for bus terminals and food outlets in shopping malls. Pest and rodent control activities are also undertaken by various private service providers. However, my ministry has, through the multi-sector stakeholders meeting on dengue, broached on the ministry's concern on leptospirosis, and an official communication has been issued to relevant ministries with regard to precautionary measures to be taken. Mr. Speaker, sir, allow me to take this opportunity to remind the population that they can significantly reduce the risk of having rats at home by taking the following precautions: regularly maintaining their yards, that is, getting rid of all clutter or waste conducive to rat proliferation, collecting and disposing of their waste regularly in appropriate channels to avoid attracting rats, securely closing their bins, and eliminating all sources of food for rodents, including pet food leftovers. Thank you, Mr. Speaker.
Thank you, Mr. Speaker. Our fatality rate so far seems to be pretty high, ranging in the figures of 10 to 12%, as said by yourself recently in a public comment during the Nurses International Day. Can I ask, which is well above what WHO consider acceptable, can I ask the Honourable Minister what specific measures have been taken by his ministry, both at the level of therapeutics and detection control, to avoid that we have such a high surge of fatalities in the event that the cases of leptospirosis keep increasing in the country despite the good intentions of the Ministry of Health?
Mr. Speaker, sir, at this point of time, because there are many rats and because these rats have invaded different regions, so the ministry has already given notice to all the other departments where there is the potential, that is, there is a possibilities of having rat infestations. And in terms of the management of leptospirosis in the hospital, there are clear clinical guidelines on clinical management on leptospirosis already been communicated to all officers, to all health officers working in the different regions. And at the same time, we have to also see that the cases of death due to leptospirosis is also due to the vulnerability of patients suffering from chronic diseases and CD diseases. So that's make patients more vulnerable, and that's why we are having death in, due to leptospirosis in Mauritius. So at the same time, we have to consider the diagnosis side, where it is being done at all levels in all the regions, and especially has been taken note that diagnosis is confirmed through specific text that is available in all other public health institutions.
Leopold. Thank you, Mr. Speaker. Can the Honourable Minister inform the House whether his ministry considers leptospirosis as a notifiable disease?
Mr. Speaker, sir. Leptospirosis is a notifiable disease under the Public Health Act.
Next question. B3 to 5.
Mr. Speaker, sir, I would like first of all to wish good luck to our para-athletes who will be participating in the forthcoming Para-Athletics World Championships in Japan. With your permission, Mr. Speaker, sir, I will now table the composition of the delegation. Thank you.
Yes, please. Yes. Can I ask the Honourable Minister whether our Rodriguez athlete form part of his delegation?
Yes, Mr. Speaker, sir. We have 2 athletes from Rodrigues and 1 coach. So, Brigitte Laclaire, Eddie Cabdo, and the coach is Mr. Fabrice Ramsamy.
May I ask the Honourable Minister whether there is an accompanying team of medical team, or whether he's made the necessary arrangement with Japanese health services should anything happen to those athletes?
Mr. Speaker, sir, in the list of the delegation, we have 1 doctor, Mr. Damien Stoic, 1 psychologist, Mr. Raman Julu, 1 massage therapist, Mrs. De Keating, 1 fitness coach, Mr. Sassoli.
Pinava Marie.
B3 to 6.
Mr. Speaker, sir, according to the United Nations Office on Drugs and Crimes, UNODC, women represent 1/3 of drug consumers worldwide and 1/5 of the estimated number of injectable drug users. The risk of contracting HIV, hepatitis C, and other blood-borne diseases are higher among women than men. My ministry has taken specific measures to address the issue of women who use drugs. The methadone substitution therapy program, which is fundamental harm reduction strategy regarding opioid use disorder, was put in place in 2006 following recommendations from the UNODC. To date, there are 5 methadone daycare centers which are operational around the island where patients are induced on methadone. In 3 of these centers, induction is exclusively done externally both for men and women, namely at Sainte Croix Methadone Daycare Center, Bullocks Methadone Daycare Center, and Maibro Methadone Daycare Center. In 2 centers, induction is done both externally and residentially, namely at Centre Frangipane, which is exclusively for men, and at Orchidee Center, exclusively for women. Mr. Speaker, sir, the dedicated female residential center for detoxification, residential methadone induction and rehabilitation, namely Orchidee Center, was opened in July 2022 within the premises of the Brown-Séquard Mental Health Care Center. Since its opening to date, some 327 patients have attended the center, that is 104 in 2022, 176 in 2023, and 47 from January 2024 to end of April 2024. The service is offered in full confidentiality, and it's adapted to the type of primary drug of concern. All the methadone daycare centers have a trained and pluridisciplinary team comprising of a psychiatrist, medical and health officer, a specialized nurse, a psychologist, a specialized healthcare assistant, and a social worker from NGOs for a proper prise en charge of patients. After comprehensive, holistic medical and psychosocial workup, patients are induced on methadone. As at end of March 2024, 8,090 patients were registered on the methadone substitution therapy program, of which 412 were women. Moreover, as per records available from January 2023 and to April 2024, out of a total number of 2,210 patients induced on methadone, 282 were women. Mr. Speaker, sir, my ministry has also set up addiction treatment units since 2018 in the 5 regional zones, and these offer services to some 6,500 attendees annually, of which some 7%, that is around 455, are women. For 2023, there are 907 new cases, of which some 7%, that is 63, were women drug users. From January to April 2024, there are 16 new cases of women drug users. Mr. Speaker, sir, women worldwide are more vulnerable to poverty, limited access to employment, and economic dependence. Drug use increases women's vulnerability to violence and exploitation, notably due to dependencies that can be exploited. Therefore, my ministry has made it a priority to provide special care for the protection, rehabilitation, and reintegration of female drug users. In collaboration with the National Social Inclusion Foundation, the resources of the NGO Grisalit, dedicated to women for years, have been significantly strengthened by increasing the number and qualifications of its professionals in order to offer tailor-made and optimal support to drug users who have undergone withdrawal or substitution treatment within the public healthcare system. It's worth noting that even though women are numerically fewer than men among drug users, very special attention is being given to them, and as for all our patients, regardless of their pathology, they are provided with holistic, specific, patient-centered care and a comprehensive care pathway.
Merci, Monsieur le ministre. Le ministre est-il au courant qu'il y a actuellement une vidéo en circulation sur les réseaux sociaux où une femme qui se dit usagère de drogue fait un appel pressant pour être réhabilitée? Si oui, quelles ont été les mesures prises par son ministère?
Mr. Speaker, sir, no, I'm not aware of any video. I would request the honorable member to share the video with me, and obviously I will send these videos to the department, to the harm reduction unit of my ministry, so that necessary arrangement can be made to offer help to this woman.
MP team. B327.
I'm informed by the Livestock and Veterinary Division of my ministry that, as at date, 6 import permits have been issued in respect of 2 importers, namely Sokovia Bellevue Limited and Ubora Ventures Limited, for the import of live cattle from South Africa for the Eid ul-Adha Festival 2024. As at date, 3 consignments consisting of a total of 5,346 live cattle have already reached Mauritius. As per the established veterinary protocols, the animals are currently in quarantine. In addition, an additional 1,425 heads of cattle are expected to reach Mauritius as from the 3rd week of May 2024. Mr. Speaker, sir, as regards part B of the question, I wish to point out that my ministry is closely monitoring the situation to ensure that there is an adequate supply of live cattle for both the Eid ul-Adha festival and for local consumption. According to information available at a date, which evidently is based on the projected demand and available stock and imports, no shortage of live cattle for the Eid ul-Adha festival or for local consumption is foreseen. In view of the above, Mr. Speaker, sir, the Mauritius Meat Authority is not envisaging to import live cattle for the time being.
As the Honourable Minister is aware, the bulk of the cattle that is sold for slaughter during Eid ul-Adha festival comes from South Africa. And earlier this month, there has been an outbreak of foot and mouth disease in South Africa, in particular in the region of the East Cape. So may I know from the Honourable Minister whether this information has been relayed to his ministry, and despite this lack of supply from South Africa, he's still confident that there will be sufficient cattle to meet the demand for the Eid ul-Adha festival?
Mr. Speaker, sir, like I said in my reply, there are already in Mauritius 5,346 live cattle that are in the premises of the different importers. And also we are expecting to have 1,425 as from this month. It is indeed a case where there's been an outbreak in one particular region in South Africa where FMD has been suspected. But from the information that I have gathered is that the animals that we source from South Africa are found very far, even as far as 400 kilometers from those infected farms.
You had one clarification, eh? York's clarification.
Yes. The Honourable Minister has mentioned that adequate supply of cattle will be made for this year. Can I ask him what measures are being taken at his ministry to ensure that the cattle is of adequate age for slaughtering for Eid ul-Adha?
Well, Mr. Speaker, sir, we all know every year we take all the necessary measures to ensure that as per the specification that is required for that particular festival, we ensure that those cattle are fully satisfy those conditions. So this has always been the case, and of course this year as well, the same principle is being applied so that we, whatever cattle being imported or are being locked for this particular celebration, fulfill those conditions.
Can the Honourable Minister inform the House about quarantine and sanitary precaution being taken?
Well, Mr. Speaker, sir, there is already a very established sanitary protocol system that is in place. And due to the fact that, that there is this outbreak in South Africa, I have, of course, asked the Livestock and Veterinary Department to enhance the control system and to ensure that whatever cattle coming from overseas at this point in time to be completely isolated, be kept in a separate farm so that there is no risk at all of any infection, just to be doubly sure that there is no kind of risk associated with those that are infected from South Africa.
Honourable members, assessed from the sitting for 1.5 hours. Honourable members, I have an announcement. Honourable members, I am pleased to inform the House that Ms. Urmila Devi Ramchand has been appointed Clerk of the National Assembly in a substantive capacity with effect from Monday, 13th May 2024. In 1996, Ms. Ramchand was awarded a Bachelor of Laws degree at the University of Mauritius. Thereafter, she joined the Best Graphics Law Publishers Limited as trainee jurist under the supervision of the late Louis-Edwin Vanchard, QC, former Solicitor General. Ms. Ramchand has also worked in the teaching profession prior to joining the civil service as Civil Status Officer in November 2005 at the Central Civil Status Office. In October 2007, she joined the National Assembly as Clerk Assistant, and in April 2014, she was promoted to the post of Deputy Clerk. In December 2009, she was awarded a Certificate of Orientation by the Lok Sabha for having attended the Parliamentary Internship Program on the working of the Indian Parliament and its parliamentary procedures and practices. On behalf of honourable members and the staff of the National Assembly, and in my own name, I extend my congratulations to Ms. Ramchand as Clerk of the National Assembly and wish her a successful career. Thank you.
announcements.
Honourable members, I have an announcement. Honourable members, I'm pleased to inform the House that Ms. Urmila Devi Ramchand has been appointed Clerk of the National Assembly in a substantive capacity with effect from Monday, 13th May 2024. In 1996, Ms. Ramchand was awarded a Bachelor of Laws degree at the University of Mauritius. Thereafter, she joined the Best Graphics Law Publishers Limited as trainee jurist under the supervision of the late Louis-Edwin Vanchard, QC, former Solicitor General. Ms. Ramchand has also worked in the teaching profession prior to joining the civil service as Civil Status Officer in November 2005 at the Central Civil Status Office. In October 2007, she joined the National Assembly as Clerk Assistant, and in April 2014, she was promoted to the post of Deputy Clerk. In December 2009, she was awarded a Certificate of Orientation by the Lok Sabha for having attended the Parliamentary Internship Program on the working of the Indian Parliament and its parliamentary procedures and practices. On behalf of honourable members and the staff of the National Assembly, and in my own name, I extend my congratulations to Ms. Ramchand as Clerk of the National Assembly and wish her a successful career. Thank you.
Announcements.
Honorable members, I have an announcement. Honorable members, I'm pleased to inform the House that Ms. Urmila Devi Ramchand has been appointed Clerk of the National Assembly in a substantive capacity with effect from Monday, 13th May 2024. In 1996, Ms. Ramchand was awarded a Bachelor of Laws degree at the University of Mauritius. Thereafter, she joined the Best Graphics Law Publishers Limited as trainee jurist under the supervision of the late Louis-Edwin Vanchard, QC, former Solicitor General. Ms. Ramchand has also worked in the teaching profession prior to joining the civil service as Civil Status Officer in November 2005 at the Central Civil Status Office. In October 2007, she joined the National Assembly as Clerk Assistant, and in April 2014, she was promoted to the post of Deputy Clerk. In December 2009, she was awarded a Certificate of Orientation by the Lok Sabha for having attended the Parliamentary Internship Program on the working of the Indian Parliament and its parliamentary procedures and practices. On behalf of honorable members and the staff of the National Assembly, and in my own name, I extend my congratulations to Ms. Ramchand as Clerk of the National Assembly and wish her a successful career. Thank you.
Announcements.
Honorable members, I have an announcement. Honorable members, I'm pleased to inform the House that Ms. Urmila Devi Ramchand has been appointed Clerk of the National Assembly in a substantive capacity with effect from Monday, 13th May 2024. In 1996, Ms. Ramchand was awarded a Bachelor of Laws degree at the University of Mauritius. Thereafter, she joined the Best Graphics Law Publishers Limited as trainee jurist under the supervision of the late Louis-Edwin Vanchard, QC, former Solicitor General. Ms. Ramchand has also worked in the teaching profession prior to joining the civil service as Civil Status Officer in November 2005 at the Central Civil Status Office. In October 2007, she joined the National Assembly as Clerk Assistant, and in April 2014, she was promoted to the post of Deputy Clerk. In December 2009, she was awarded a Certificate of Orientation by the Lok Sabha for having attended the Parliamentary Internship Program on the working of the Indian Parliament and its parliamentary procedures and practices. On behalf of honorable members and the staff of the National Assembly, and in my own name, I extend my congratulations to Ms. Ramchand as Clerk of the National Assembly and wish her a successful career. Thank you.
such as provisions and storage of mats and other basic necessities, such as bottled water, canned food and biscuits in the state centers, registration of evacuees. A new register was made to capture details of families who take refuge in our centers, adequate staff in evacuee centers to take care of people seeking refuge in these centers, and my ministry is constantly connecting with all these centers and provide help and assistance throughout those tough times. Mr. Speaker, 166 evacuee centers have been identified around the island, and my ministry employs on needs and ad hoc basis 3 officers, 1 supervisor, an assistant supervisor, and a caretaker to operate each of the evacuee centers. As I mentioned at the beginning of my reply, all these centers are supplied with basic necessities. Prior to and throughout each cyclonic season, regular visits are carried out by officers of my ministry to make sure that the stock of basic food items in the centers is replenished and is of good quality and not expired. To provide further support and assistance to people in the centers during natural calamities, my ministry has taken a series of additional measures, such as provision of free hot meals, breakfast, lunch, and dinner per day during cyclones and heavy rainfall, prepared and cooked by the prison institution, provisions of baby cots. I wish to inform the House that in accordance with the Social Aid Regulations 1984, the following allowance are payable. Cyclone allowance of $250 per person per night is spent at evacuee center, and flood allowance of $250 for damaged foodstuff per person per day for a maximum of 3 days upon presentation of a police memo. Yes, in view of high number of families affected in the region of Port Louis, a decision has been made to effect payment of flood and cyclone allowances at the Municipal Council of Port Louis instead of Astor Court. This measure has facilitated and is facilitating and sped up the whole process. Mr. Speaker, I'm informed that the National Risk Reduction and Management Center has regular discussions with my ministry, other ministries and stakeholders to review the existing protocol applicable when necessary to support and provide additional help. Thank you.
Je vous remercie, Monsieur le Président. La ministre considère-t-elle acceptable que les centres de refuge...
Ask for a clarification.
It is a clarification,
not a
Mr.
new question.
No, it is a clarification, Mr. Speaker. Okay? La ministre considère-t-elle acceptable que les centres de refuge ne respectent pas la dignité des personnes déplacées en les contraignant...
This is not. I disallow this question. I move to the next question. I disallow and I move to the next question. MP Mohamed.
B 330.
Mr. Speaker, sir, with your permission, I shall reply to this PQ. With regards to part A of the question, I am informed by the new Social Living Development Limited and SLD that 200 housing units are being constructed at Mont Albert, out of which 192 units are of row type, that is ground plus one, and the remaining 8 units are of duplex type, consisting of ground floor only. I am tabling the layout plan. As regards to part B, I am